Hi, welcome to my YouTube channel, Orthodontics by Dr. Kieran Daly. Today we're really excited to introduce our guest, Dr. Dylan Murray, who is a plastic reconstructive surgeon with a special interest in corrective jaw surgery. So, Dylan, today we're going to ask you some questions for our audience, and we're going to start with if you'd like to tell us a little bit about what is corrective jaw surgery.
So, corrective jaw surgery is surgery of the teeth and jaws, which aims to change the bite, the airway, and facial disproportion. The aim of this is to improve the harmony of the face.
Thanks, Dylan. So, why do you think a patient might want or need corrective jaw surgery?
Okay, well, that's an interesting question, Kieran, because the first thing is that nobody needs corrective jaw surgery. I often say to patients, nobody ever died of a bad bite. However, orthodontics can correct most crooked teeth and improve the bite, but very often the bite can't be improved by just straightening the teeth because the jaws are not proportionate. So the only way to correct it in that case is to straighten the teeth and go through a process where the teeth are aligned in both jaws so that ultimately when the patient undergoes corrective jaw procedures and the jaws are realigned, the bite fits perfectly.
So Dylan, maybe for our audience you'd like to tell us what would be involved in the process of a patient who wants to have or needs corrective jaw surgery.
Okay, so in the first instance, patients have to realise that it is a combination of orthodontics and surgery. And there are lots of different aspects to this. In some cases, the orthodontics can be quite quick and get the teeth ready within a matter of 6 to 12 months, and occasionally it can be quite prolonged. In some instances, you need a smaller procedure, which we call a SARMI, a surgically assisted palatal expansion, prior to undergoing the orthodontics, just to expand the jaws. But following the orthodontics and the alignment of the teeth, one then undergoes jaw surgery under general anaesthetic. So the jaw surgery itself is undertaken under general anaesthetic, and in most cases patients stay in overnight. But once asleep, we essentially break the jaws in a very controlled way using very specific instruments, very modern instruments that minimize swelling, bleeding and so on. And once the jaws are broken, we can then use splints that are produced in a laboratory to position the jaws before we secure them in that position using plates and screws.
And Dylan, that sounds like quite a complex procedure. How do you plan this?
So all this planning starts from the very beginning with the planning of the orthodontics, precisely where the teeth should be, and specifically trying to determine where the teeth will be in the final position. Following that, we then take CT scans and intraoral scans. You're familiar with those. So we then incorporate the scans into our virtual planning software. And with this virtual planning software, we can move the jaws to try and get an indication of what's the best position. Ultimately, we're looking at the bite. We're looking at how the patient might look after surgery. But also we look at things like their airway and making sure that we don't in any way constrict their airway. In fact, we often want to improve their airway and open it up.
So Dylan, sometimes my patients ask me, will this change their appearance significantly? What would you say to these patients?
Well, the obvious thing to say is that yes, it does change your appearance. However, it doesn't change your appearance in such a way that people don't recognize you, your family or friends. Clearly, in many cases, you're there having surgery with the view of changing the way your teeth look and the projection of your jaws, maybe your chin and so on. So there is an expectation that that's going to change. But actually, by putting the jaws into a more sort of harmonious position, then everything kind of fits in together. And patients have often said to me, or used the expression, I'm a better version of myself.
So Dylan, we've been working together now for more than 15 years. We've probably done over 100 cases. Yeah. So how would you say this has changed or evolved during that period?
The two main changes are in the way, particularly that we plan them now, where we use a lot of software packages that are that help us to plan these more specifically, more precisely, and also in theatre and with modern anaesthetic techniques, we're able to bring patients through the surgery, and their post-operative journey is much easier. Altogether, there's no question that patients have benefited significantly over the last 15 years from our experience nowadays. And without question, patients tend to be very, very happy with their outcomes and their recoveries.
So, Dylan, what are the risks and what are the downsides of this type of procedure?
Okay, so I guess with any kind of surgical procedure, there are risks associated with it. But actually, things have changed an awful lot. And we use very modern techniques in anaesthetics. We use instruments that are very modern, that don't cause as much trauma to the tissues, to the skin, to the bone as would have in the past. And we use plates and screws rather than wiring their jaws together. You can get some numbness post-operatively of the lip and chin, but that generally settles down within 4 to 6 weeks. It would be extremely rare that somebody would end up with any permanent numbness, particularly nowadays with the kind of instruments that we use to make the cuts in the bone. Prolonged swelling can sometimes happen, although this is also quite rare. But really, something drastic happening, something that would leave somebody permanently worse off, would be extremely rare. So the recovery is actually quite quick, and my experience has been that most patients immediately after surgery have a little bit of bruising. We use specific machinery, we use a specific mask to control the post-operative swelling. It's a cooling device. And we also prescribe medications that minimize the discomfort and pain afterwards. Most patients will tell us that within 4 or 5 days, they're back to normal in terms of their eating, although it is a soft diet, in terms of managing their pain. But ultimately, within 10 days, they're ready to go back to work, back to college. The only real restriction is in terms of getting back to physical activity, particularly contact sports, which you have to minimize for up to 8 weeks after corrective jaw surgery. But all other routine gym work and so on that doesn't involve contact sports, within 3 weeks one can get back to that. Ultimately, I would expect that a patient by the end of the 3rd week would be fully back to normal, fully recovered, back to their usual work life or school, college, whatever. This is quite an involved project for somebody to undertake. It involves orthodontics and jaw surgery. If anybody's considering this, clearly they need to talk to the orthodontist in the first instance to see what can be done. Because sometimes it's not just orthodontics, it's other aspects of dentistry, oral rehabilitation and so on that might be needed. But obviously, if corrective jaw surgery then is something that is required to correct the bite fully, then you need to go and see a jaw surgeon who performs this on a regular basis.
So, Dylan, what advice would you give to a patient who's preparing themselves for jaw surgery?
Interesting question. So, a couple of weeks before jaw surgery, the first thing is that the patient needs to be fully aware of what's going on. So they need to inform themselves, talk to their surgeon, see what's going to be involved, particularly on the day, because patients can get quite nervous. But in general terms, obviously, smoking and drinking is something that you should avoid. If there's any family members who are sick, then you need to be avoiding those because you don't want to be coming into hospital with a bit of a flu or something. But otherwise, stocking up on the general things that you're going to need after a surgical procedure, like medications and the usuals, paracetamol or Nurofen, which you'll be taking 4 or 5 days after surgery. You'll have started on the stronger painkillers prescribed by the surgeon. But the main thing around preparation is in terms of the diet post-operatively. So patients who have had jaw surgery are on a soft diet. And I generally have a simple rule, which I think you know, Kieran, which is that you can eat what you like as long as you're not chewing. And in most cases, this means that in the first 24 hours, it's just clear fluids. After that, for another day or two, it's juices and smoothies and so on. But within 4 or 5 days, you should be able to start eating very soft foods like mashed potato, scrambled eggs, even rice that's nice and soft, pasta that's well cut up. But ultimately, there shouldn't be any restriction in the quality of the food that you eat. I tell my patients to maintain the constituents of their diet, the usual diet that they have, but they just need to make it softer and make it easier to swallow.
Thank you. So Dylan, patients often ask me, will they have scars after their corrective jaw surgery?
So when we're doing corrective jaw surgery, we need to get access to the bone, but almost all the access has gone through the mouth. We cut into the gum and that exposes the bone for us. Very rarely we have to put a tiny little cut on the cheek or sometimes even on the nose, where we use to measure exactly where we're putting the jaw. But for the most part, there are no scars on the outside and people don't have to be worried about that.
So for anybody out there who'd like to find out more information or who'd like to contact us, probably the best way is through my website, orthodontics by drkierandaly.ie. You can find my contact details or you can find Dylan's contact details, and please feel free to reach out, or you can also comment in the comments box below. So I hope all you guys have really enjoyed this. I certainly have, and I'd like to thank Dylan for his time and coming in today and helping us to make this video.
My pleasure.